Tuesday, February 13th, 2024, and this is Reporting Live with Dr. Desai. Today, I'd like to talk about prostate cancer and prostate cancer awareness. We're seeing a lot in the news about prostate, bladder, genitourinary cancers occurring in males. There's some well-known males across the world who may be experiencing this, and I'm not here to speculate about any of that, whether it's the royal family, U.S. government officials. What I really want to do is focus on what we need to do for education around prostate cancer. So here's the basic facts. Prostate is a walnut-sized gland. It resides in the lower part in the pelvic area of a male. It does have function, but we're here to talk about what it can do when it becomes enlarged or cancerous. So prostate cancer is actually the second leading cause of cancer in the United States among men. We need to be aware. It rarely happens in the younger population, but starting at age 50 and especially between 60 and 75, we see increasing cases, and African Americans are the ethnicity that is most affected. So we really want to pay attention to that, but all ethnicities can be affected. What are the symptoms and what should you be worried about with prostate cancer? Well, first and foremost, urinary hesitancy. That means the stream of urine in a male is not continuous or not strong. Frequent urination. Think about this. You have a bladder that's full of urine. You're trying to empty it, but the prostate's coming in there, getting big, and blocking the bladder from emptying. It's real and can happen. Here's a question that comes up. Just because I have an enlarged prostate, does that mean I'm going to get prostate cancer? The answer is no. An enlarged prostate is quite common in our males, especially as they age, but to differentiate if it's normal or if it's something serious like prostate cancer, we need to do screening and see your primary care physician. Other signs. So I mentioned urinary hesitancy, blood in urine, urinary frequency increasing, pain in the back, weight loss, just not feeling well. Those are some signs to think about in addition to blood in the urine. Other things, if you have a family history of prostate cancer, that certainly is a risk factor too. There's a theory out there that cigarette smoking could be an independent risk factor for prostate cancer. So what do you do if you think you have an enlarged prostate? First and foremost, you need to see a physician. Whether it's a primary care physician or somebody you have access to another provider, you need to do possibly a digital rectal exam. Not pleasant, I fully understand that, but that is a good way to measure and really see how big the prostate is. Not an actual measurement, but to see how big it is. There's also a blood test called a PSA, or prostate-specific antigen, that can be used and measured in your blood to determine if you may have high-risk prostate cancer or blood test levels indicating prostate cancers. IPSAs typically indicate prostate cancer, but there are reasons the PSA or prostate-specific antigen can go up and not be prostate cancer. Hence, we need to see our physicians. When should all that screening start? Right around age 50 or a high family history risk, sometimes a little sooner. But pay attention to those urinary signs. That's the first thing to pay attention for prostate health. This is Reporting Live with Dr. Desai, Tuesday, February 13th, 2024. Feel free to leave some questions or any comments on this in the comments field.